So we found her 2 spots, and so that first spot is the medial bicep. That's a really popular location. I find that on a lot of patients. This next spot, however, I don't get this much. So this is more of the subscapularis, I'd say, or maybe even the lat. We'll probably end up getting both. I don't know how that's gonna work. We probably have to do one of these.
Okay.
So let's have you put your arm down. That should work.
And just relax it.
Yep. All right. This pad off the back. All right. Here. Now lift up that armpit for me.
Why are you doing it on both sides?
So the reason why we do it on both sides is we want to symmetrically train the body when we're treating a left or a right complaint, because we want the neuromuscular retraining to be symmetrical in the brain. We don't want to just rehab one side because that will confuse the brain. We want symmetrical neuroplasticity when we're going through. How would you explain that? Like, well, do you have any input on that?
No, I think that's pretty accurate.
Pretty accurate?
Yep.
Okay. It's not that there's nothing wrong, like anything wrong with unilateral, but you know, if we're here and we got 4 leads, it makes more sense to just train symmetrically. All right. Now to pick an exercise. Have any recommendations, Dr. Andrew?
To activate both the medial bicep and the serratus anterior subscapularis and latissimus dorsi.
Maybe internal, external rotation?
I was going to go simple and say teeter-totter.
You just want to do a teeter-totter?
Yeah.
All right, let's do it. Okay, so we're gonna have Angie step out, and then we're gonna have her face towards the mirror. And this is just a 2-pound bar. A lot of people get scared of the metal here. You don't have to be scared of the metal. We do water treatments with this for a variety of conditions. Dr. Andrew is gonna be putting a post up of all the different things we treat with this. So I'm not gonna go into too much detail with that now. We're just gonna kind of focus on what's going on right here. So I'm gonna have Angie spread out her arms a little bit. I want her to shoulder pack down and back, good form. And a teeter-totter is essentially you just lift up one side as high as you can, lower, and then lift the other side as high as you can, and then lower. And we're just gonna have her do this a few times without any electricity, just to check her form. All right, and we are good to go. So we're gonna do 8 sets of 10, and we're gonna start. So we're gonna introduce a signal. Give me 1 second here. We gotta balance it. Come on. All right, here we go. So we're gonna bring her up. Does that feel okay?
Yep.
All right, and start your teeter-totter. And when she's going through the movement, we want to make sure that she maintains good form. Especially when we start increasing the output, because the more we increase the output, the amount of current we're putting through her body, the more likely she is going to start to lose some control. We want her to regain that control.
So what points on the body are you currently observing?
So straight arms for one, especially with a teeter-totter, because with form we want her to maintain straight arms. We want her to maintain shoulder packing. We see a lot of people with shoulder dysfunction are not good at shoulder packing. A lot of people roll their bodies forward like this, and that creates a lot of shoulder dysfunction. So people that work desk jobs, or even people that are improperly weightlifting in a gym, we see that a lot with. And then we want her to maintain wrist control. So not too much wrist extension, not too much wrist flexion. So now we're gonna go into our next set. So we're gonna increase the current
Okay.
right there.
Mm-hmm.
And we typically go to patient tolerance. So then she's gonna go through again. She's gonna do 10 repetitions. There's typically numbers we're trying to hit on the first, second, and third set, but sometimes we just can't do that just based off of the intensity and the pain.
The intensity gets less as you complete your reps.
Yep.
Okay.
So she's adapting. That's that neuromuscular retraining component. So now we're gonna go up to her tolerance.
Okay, good.
Good right there. So her first set was at 7 output. This is 7 out of 100. Her second set was 9 out of 100. Her third set is 11 out of 100. So we don't really need much stimulation, and we're gonna get some really powerful effects here. And then something I like to do too is I like to make sure that the pads are maintaining contact.
They're maintaining contact.
Good. All right, and then for this fourth set, we're gonna do a max out. So I'm gonna push her up as high as she can go. So we're at 13 out of 100.
All right, right there.
Right there, okay. So she's at 13.3 out of 100. And yes, it's pretty difficult. There's a lot of activation, a lot of things she's feeling, but the end results are usually pretty predictable. And she's maintaining really good form.
Okay.
All right, so we're gonna bring it down. Pretty much we're gonna replicate the same output we did on the first set. So it's 8 sets. The first 4 sets are on something called just a normal polarity, which is a negative to a positive. And then we're gonna reverse the polarity. It's gonna go positive to negative. And she could sense that change,
Mhm.
right as I switched it.
Yep.
So we're right at 7. I'm actually gonna just bump it up a little bit. We'll go to 8, and then I'll
Okay.
have her start.
All right. End of the dead 8.
Yep, so you're gonna do 10
Okay.
repetitions. Yep. So we're gonna see like flushing of the skin, more blood flow. The muscle contractility is usually very obvious, especially the more output we introduce.
Okay.
All right, so that's her 5th set. Now we're gonna go into her 6th set. We're gonna bump up the output. We're at 10. You can go a little higher if you'd like.
A little bit.
All right, we're at 11. We'll go
Okay.
right there. So 10 repetitions. Her form is almost too good. I would say really good. Usually I like to make people struggle a little bit more and force them to correct their form.
I can blooper for you.
I think on the max set we'll challenge that so people see what that's like.
Okay.
All right. So now we're going into our 7th set. We're gonna bump it up. So you were at 13 right now.
Okay.
All right. Shoulders are packed. She has good contact on the pads. Her arms are straight. Her wrists are straight.
But it's definitely harder to get that teetering.
Yep. Especially with it being right underneath your arm.
Mm-hmm.
You're challenging the subscap and the latissimus dorsi. I think I said that right. Usually I just say lats. All right, now we're gonna go into our max out set. I'm gonna challenge her a little bit more than last time. I wanna see her struggle to maintain form. All right, so we're at 15. We're at 16.
Okay.
And 17. 17 out of 100. Let's get those shoulders packed for me. Shoulders packed. Good. So there we had a little bit of cueing, some reinforcement. And then what's good about mirrors is she can self-cue and self-correct. All right. And then what I'll do to kind of spoil her a little bit is we're gonna do our off-duty cycle. We're gonna push the output all the way up. And so she may just feel like a little bit of a tingle right now, maybe nothing at all, but this is more of that recovery process. So the treatment was our on-duty cycle. That's where she's feeling a current, she's working through that current as she does an exercise. The off-duty is, how would you explain off-duty?
So off-duty is no longer producing a waveform that causes a muscular contraction, so it's not activating the nerve itself, but what it is doing is allowing current to flow through the body. Essentially, your blood has ions contained within it, and this will draw your blood to the areas of the body that the pads are located, thus inducing healing.
That was a way better explanation than what I would have done. So, and then, you know, I could have her sit down or stand up, and we do 10, 20 minutes of off duty and just have her recover, right? So with this treatment, because it's so intense and it's 5, 7, 9 PT sessions in one, however you want to scale it, having this component allows us to get her to recover a little bit so that she doesn't have too much soreness after. If you're just strictly doing either treatment or performance with no recovery aspect, the amount of soreness is pretty insane. I would equivalent it to newbie gain soreness, which is 3, 4, 5 days of intense DOMS.
So why don't you put that bar down and see if you can do a few of the movements that cause your shoulder to hurt right now, and if there is anything, and kind of let us know what you find.
Okay, so usually things that would bother it would be to reach up and to reach over. So I would get a little bit of pain in the shoulder, so I can come up, I can reach over, and I don't have any pain. Normally I would get pain right in my trapezius. I usually get like a knot of pain in there.
Okay.
My neck, I can rotate my neck to the side and I can turn, and I don't have that restricted movement. Usually I can get good rotation and good flexion from one side to the other, but it gets stuck, I guess would be the best way to describe it.
Right.
And then I'll get like a shooting pain into the trapezius, up into the neck, right over into, you know, that occipital area, just from that muscle tension and the tension
Right.
being held in that shoulder. So
Okay.
not quite sure what causes it. I try to
Right.
be mindful for, you know, posture at work, but you know, when you're sitting in front of the computer for hours and then always looking off to the side,
It adds up for sure.
it adds up. So
Right. And so what would you have rated, I probably should have asked this beforehand, what would you have rated the left shoulder pain before we started this treatment today?
probably about a 7.
7 out of 10. That's really
7
high.
out of 10. And right now, I'm probably 1, maybe. I don't really have any pain.
Right. And that was
So
20 minutes. Right. So imagine 20 minutes multiplied by how many hours and hours and hours of PT and chiropractic adjustments and massage therapy and acupuncture and anything else that I can think of that you'd have to do to just get that to that point. Right. And we did that in 20 minutes. Now the trick is to keep that to maintain. And that's where we go through multiple treatments, unraveling that onion peel, scoping out all the dysfunctional areas, and then honing in on the problem. Because the goal really is to get you to 0 out of 10, and also any movement that was causing pain, completely allow us to get you where you can do those movements again without having that pain, without having that restriction. But I mean, that's incredible. 30-minute treatment, 20-30-minute treatment, and that's the results we get so fast. And we see this consistently with pretty much every patient. I can't really think of one patient that didn't have positive results. And